Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a little bit more about peripheral neuropathy. So this is day 119, and I've talked about peripheral neuropathy for 119 days, or this is the 119th day, but still there's individuals that are confused that don't completely understand. So let me give you a little bit of information. There are 4 types of peripheral neuropathy. You can have any one of these, or you can have all 4 of them, and they present very, very differently, and they actually are very important that you understand what they are. So number 1, let's make sure you understand what peripheral neuropathy is. When it comes to the nervous system, you have the central nervous system, which is the brain and spinal cord. The peripheral nervous system is everything else, anything that's any of the nerves that are not in the brain or spinal cord. So these additional nerves are the peripheral nerves, and they are broken up into the somatic nervous system and the autonomic nervous system. So the somatic nervous system has 2 parts, sensory and motor. And the autonomic nervous system has the autonomic nerves, the nerves that control the involuntary or automatic functions of the body. So when it comes to peripheral neuropathy, you're going to have autonomic neuropathy, and you're going to have the types of somatic neuropathy. So with autonomic neuropathy, it controls the automatic function of the body, and you're going to have abnormalities of circulation because it controls the expansion and contraction of blood vessels. You're going to have abnormalities of the oils and the sweat released to the skin, and you can have a lot of systemic side effects from this autonomic system. I'm not going to go into those. I actually have covered them in other videos, but you can have an autonomic neuropathy, which is confirmation that you have a peripheral neuropathy, without any somatic neuropathy function. So you could literally say, I have peripheral neuropathy, and my only symptoms are the autonomic nervous system problems. Likewise, you can have just a somatic peripheral neuropathy. So you could have an autonomic neuropathy, or you could have somatic. Somatic is broken into, like we said, sensory or motor. So you could have just a motor peripheral neuropathy, where the nerves going to the muscles are not functioning like they're supposed to. So you're going to get muscle atrophy, you're going to get muscle weakness, you're going to get injury, falls, those kind of things, because the motor nerves are not working like they're supposed to. So the muscles themselves start to malfunction. They're not working like they're supposed to. You could have just a motor neuropathy. So there will be individuals that are evaluated and they're told by their doctor, well, you don't have neuropathy because it's just the muscles that are malfunctioning. Guess what? That is a peripheral neuropathy of the motor nerves. So you can have an autonomic neuropathy that is just the autonomic neuropathy. You can have a motor neuropathy that is just the motor neuropathy. Or you can have a sensory neuropathy that could be just small fiber sensory neuropathy or large fiber sensory neuropathy, which are different nerves. The small fiber sensory neuropathy are the nerves that are furthest away from the spinal cord and the brain. Whereas the large fiber neuropathy, of course, the larger larger sensory nerves that are causing the sensory neuropathy. So you could have any one of those 4. You could have an autonomic neuropathy, you could have a motor neuropathy, you could have a small fiber sensory neuropathy, or a large fiber sensory neuropathy. You could also have any combination of those. You could have an autonomic neuropathy and a small fiber neuropathy, or you could have a motor neuropathy and a large fiber neuropathy, or a motor neuropathy and a small fiber neuropathy, or motor neuropathy and an autonomic neuropathy. The idea is any one of these 4 can be affected, and it's still a peripheral neuropathy. So do you have peripheral neuropathy? You need to test all 4 nerves. You can't just do a electrical nerve evaluation, nerve velocity testing, or EMG testing, and say you don't have peripheral neuropathy because it's normal. Guess what? You can have a normal test on any one of these 4 areas and still have peripheral neuropathy. So you need to be evaluated. You need to be looked at. You need to say, okay, do I have a small fiber sensory neuropathy? Yes or no. Do I have a large fiber sensory neuropathy? Yes or no. Do I have a motor neuropathy? Yes or no. Do I have an autonomic neuropathy? Yes or no. All of those should be tested. All those should be evaluated. And the truth is, then you'll know what to treat, because you can say, okay, I have an autonomic neuropathy, so I need to do treatments that will help autonomic nerves. I have a motor neuropathy, so I need to do treatments that help the motor nerves. And there may be bracing I need to do. There may be other things that I need to do to prevent injury in the process while I'm getting things better. So look at the whole picture. understand the whole thing and know that peripheral neuropathy could be any one of the 4 different types of peripheral neuropathy, or it can be a combination. Truthfully, it could be all 4. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 119. The 4 different types of neuropathies that could indicate a peripheral neuropathy. Have a great day.